Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, July 3rd at 10 a.m. As always, and particularly this week, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined via video conference by Miranda Ollstein of Politico.
Hello.
Sarah Karlin-Smith of The Pink Sheet.
Hi, everybody.
And Maya Goldman of Axios News.
Good to be here.
No interview this week, but more than enough news, so we will get right to it. So as we sit down to tape, the House is on the cusp of passing the biggest constriction of the federal social safety net ever, part of President Trump's, quote, one big beautiful bill, which is technically no longer called that because the name was ruled out of order when it went through the Senate. In an effort to get the bill to the president's desk by the July 4th holiday, a.k.a. tomorrow, the House had to swallow without changes the bill that passed the Senate on Tuesday morning after Vice President J.D. Vance broke a 50-50 tie. And the House has been in session continuously since Wednesday morning, working to do just that, with lots of arm twisting and threatening and cajoling to walk back the complaints from both conservative Republicans who are objecting to the trillions of dollars the bill would add to the national debt, as well as moderates objecting to the Medicaid and food stamp cuts. There is a whole lot to unpack here, but let's start with Medicaid, which would take the biggest hit of the health programs in this bill. Ironically, just weeks before the program's 60th anniversary. What does this bill do to Medicaid?
This bill makes some huge changes to the way that Medicaid is funded and delivered in the United States. One of the biggest changes is the first federal work requirement for Medicaid, which we've talked about, at length.
Pretty much every week.
Pretty much every week. I mean, it's sort of death by paperwork for many people. They're not necessarily forced to lose their coverage, but there are so many paperwork hurdles and barriers to making sure that you are reporting things correctly that CBO expects millions of people are going to lose coverage. And we know from limited experiments with work requirements in Arkansas that it does not increase employment. So that's the biggie.
The House froze provider taxes, which is what most, all states but Alaska, use to help pay their share of Medicaid. The Senate went even further, didn't they?
Yeah. Hospitals are saying that it's going to be absolutely devastating to them. When you cut funding, cut reimbursement in that way, cut the amount of money that's available in that way, it trickles down to the patient and ultimately.
Especially things like the provider tax, but even just the loss to certain health systems of Medicaid patients end up having a spiral effect where it may impact people who are on other health insurance because these facilities will no longer have that funding to operate the way they are. Particularly, some facilities talked about how the Obamacare Medicaid expansion really allowed them to expand their services and beef up. And now if they lose that population, you actually end up with risks of facilities closing. And the Senate tried to provide a little bit of money to alleviate that, but I think that's generally seen as quite small compared to the long-term effects of this bill.
Yeah, there's a $50 billion rural hospital slush fund, if you will, but that's not going to offset $930 billion in cuts to Medicaid. And it's important, I know we keep saying this, but it's important to say again, it's not just the people who will lose Medicaid who will be impacted, because if these facilities close, and we're talking about hospitals and rural clinics and, other facilities that depend on Medicaid, people with all kinds of insurance are going to lack access. I see lots of nods going around.
Yeah. One salient example that somebody told me earlier this week was, you think about ER wait times. It's already takes so long to get seen if you go into the ER. And when people don't have health insurance, they're seeking care at the ER because it's an emergency and they waited until it was an emergency, or, that's just where they feel they can go. But this is going to increase ER wait times for everybody.
And also, if nursing homes or other facilities close, people get backed up in the ER because they can't move into the hospital when they need hospital care because the hospital can't discharge the people who are already there. I had sort of forgotten how that the crowded ERs are often a result of things other than too many people in the ER. They're a result of other strains on sort of the supply chain for care.
There's so many ripple effects and dominoes that are going to fall, if you will.
So there were some things that were in the House bill that, as predicted, didn't make it into the Senate bill because the parliamentarians said they violated the budget rules for reconciliation. That included the proposed Medicaid ban on all transgender care for minors and adults, and most of the cuts to states that use their own funds to cover undocumented people. But the parliamentarian ended up kind of splitting the difference on cutting funding to Planned Parenthood, which she had ruled in 2017 Congress couldn't do in reconciliation. Alice, what happened here?
She decided that 1 year of cuts was okay when they had originally sought 10. And the only reason they originally sought 10 is that's how these bills work. It's like a 10-year budget window. That's how you calculate things. They sort of meant it to function like a permanent defund. So the anti-abortion movement was really divided on this outcome, where some were declaring it a big victory and some were saying, oh, only 1 year, this is like such a disappointment and not what we were promised, blah, blah, blah. And it'll be really interesting to see if even 1 year does function like a sort of permanent defund. So on the one hand, the anti-abortion movement is worried that because it's 1 year, that means they'll have to vote on it again next year, right before the midterms, when people might get more squirrely because of the politics of it, which obviously still exists now, but would be more potent then. But clinics can't survive without funding for long. We're already seeing Planned Parenthoods around the country close because of Title X cuts, because of other, budget instability. And so once a clinic closes, even if the funding comes back later, you can't flip a switch and turn it back on. When things close, they close, the staff moves away, et cetera.
And we should emphasize Medicaid has not been used to pay for federal abortion funding.
Yes.
Ever.
Yes.
That's part of the Hyde Amendment. So we're talking about non-abortion services here. We're talking about contraception and STD testing and treatment and cancer screenings and other types of primary care that almost every Planned Parenthood provides. They don't all provide abortion, but they all provide these other ancillary services that lots of Medicaid patients use.
Right. And so this will shut down clinics in states where abortion is legal, and it'll shut down clinics in states where abortion is illegal. And these clinics only are providing those other reproductive health services, which are already in scant supply and hard to come by. There's massive maternity care deserts, contraceptive deserts around the country, and this is set to make that worse.
So while this bill was not painted as a repeal of the Affordable Care Act, unlike the 2017 version, it does do a lot to scale that law back. This has kind of flown under the radar. Maya, you wrote about this. What does this bill do to the ACA?
Yeah, well, so there were a lot of changes that Congress was seeking to codify from rule that the Trump administration has finalized that really create a lot of extra barriers to enrolling in the ACA. A lot of those did not make it into the final bill that is being voted on, but there's still more paperwork, death by paperwork. I think there's pre-enrollment verification of eligibility, things like that. And I think just in general, the ACA has created massive gains in the insured population in the United States over the last decade and a half. And there's estimates that show that this would wipe out 3/4 of that gain. And so it's just staggering to see that.
Yeah, I think people have underestimated the impact that this could have on the ACA. And of course, we've talked about this also a million times. This bill does not extend the additional subsidies that were created under the Biden administration, which has basically doubled the number of people who've been able to afford coverage and bought it on the marketplaces. But I've seen estimates that more than half of the people could actually end up dropping out of ACA coverage.
Yeah, and I think it's important to talk about the timelines here. A lot of the work requirements in Medicaid won't take effect for a couple of years, but people are going to lose their enhanced subsidies in January. And so we are going to see pretty immediate effects of this.
And they're shortening the enrollment time, and people won't be able to be auto re-enrolled, which is how a lot of people continue on their ACA coverage. There are a lot of little things that I think together add up to a whole lot for the ACA.
Right. And, Trump administration ACA enrollment barriers that were finalized might not be codified in this law, but they're still finalized. And so they will take effect for 2026 coverage.
And while President Trump has said repeatedly that he didn't want to touch Medicare, this bill, ironically, is going to do exactly that, because the amount the tax cuts add to the deficit is likely to trigger a Medicare sequester under budget rules. That means there will be automatic dramatic cuts to Medicare, probably as soon as next year. All right, well, that is the moving bill, the one big beautiful bill. One thing that has at least stopped moving for now is the Supreme Court, at least for the moment. The justices wrapped up their formal 2024-2025 term with some pretty significant health-related cases that impact two topics we're talking about elsewhere in this episode, abortion and vaccines. First, abortion. The court ruled that Medicaid patients don't have the right to sue to enforce the section of Medicaid law that ensures free choice of provider. In this case, it frees South Carolina to kick Planned Parenthood out of its Medicaid program. Now, this isn't about abortion. This is about, as we said, other services that Planned Parenthood provides. But Alice, what are the ramifications of this ruling?
They could be very big. A lot of states have already tried and are likely to try to cut Planned Parenthood out of their Medicaid programs. And given this federal defund, this is now going after some of their remaining supports, which is state Medicaid programs, which is a separate revenue stream. And so this will just lead to even more clinic closures. And already this kind of sexual health care is very hard to come by in a lot of places in the country. And that is set to be even more true in the future. And this is sort of the culmination of something that the right has worked towards for a long time. And so they had just a bunch of different strategies and tactics to go after Planned Parenthood in so many ways in the courts. And there's still more shoes to drop. There's still court cases pending. There's one in Texas that's accusing Planned Parenthood of defrauding the state. And so that judgment could wipe them out even more. This federal legislative effort, there's the Supreme Court case, and they've really been effective at just throwing everything at the wall and seeing what sticks. And enough is sticking now that the organization is really, they were able to beat back a lot of these attempts before. They were able to rally in Congress. They were able to, rally at the state level to push back on a lot of this. And that wasn't true this time. And so I don't know what conclusion to take from that. There's obviously people are very overwhelmed. There's a lot going on. There are organizations getting hit left and right, and maybe this just got lost in the noise this time.
Yeah, I think that may be. Well, the other big Supreme Court decision was one we talked about quite a bit, the so-called Braidwood case that was challenging the ability of the CDC's Preventive Services Task Force from recommending services that would then be covered by health insurance. This was arguably a win for the Biden administration. The court ruled that the task force members do not need to be confirmed by the Senate. But Sarah, this also gives Secretary Kennedy more power to do what he will with other advisory committees, right?
Right. By affirming the way the U.S. Preventive Services Task Force was set up, in that the HHS secretary is ultimately the authority for appointing the task force, which then makes recommendations around what coverage requirements under the ACA. It also sort of affirms the authority of the HHS secretary here. And, I think people think it has implications for other bodies like CDC's advisory committee on vaccines as well, where the secretary has a lot of authority. So I think people who really support the coverage advantages that have come through the U.S. PTF and Obamacare have always pushed for this outcome in this case. But given our current HHS secretary, there are some worries that it might lead to rollbacks or changes in areas of the healthcare paradigm that he does not support.
Well, let us segue to that right now. That is, of course, as you mentioned, the other major CDC advisory committee, the one on immunization practices. When we left off, Secretary Kennedy had broken his promise to Senate Health Committee Chairman Bill Cassidy and fired all 17 members of the committee, replacing them with vaccine skeptics and a couple of outright vaccine deniers. So last week, the newly reconstituted panel held its first meeting. How'd that go?
It was definitely an interesting meeting. Different, I think, that for people who have watched ACIP in the past, besides just getting rid of the members of the advisory panel, Kennedy also removed a lot of the CDC staff who work on that topic as well. So the CDC staffers who were there and doing their typical presentations were much smaller in number. And for the most part, I think they did a really good job of sticking to the tried and true science around these products and really having to grapple with extremely, I think, unusual questions for many of the panelists. But the agenda got shrunk quite a bit, and one of the topics was quite controversial. Basically, they decided to review the ingredient thimerosal, which was largely taken out of vaccines in the late 90s, early 2000s, but remains in certain larger vials of flu vaccines.
It's a preservative, right? You need something in a multi-dose vaccine vial to keep it from getting contaminated.
And they had a presentation from Lynn Redwood, who was a former leader of the Children's Health Defense, which is a very anti-vax organization started by Robert Kennedy. The presentation was generally seen as not based in science and evidence, and there was no other presentations, and the committee voted to not really allow flu vaccines with that ingredient. And the impact in the U.S. here is going to be pretty small because I think it's about 4% of people get vaccines through those large quantity vials, like if you're in a nursing home or something like that. But what people are saying, and Scott Gottlieb was talking a lot about this last week, was that this is really a hint of what is to come and the types of things they are going to take aim at. And he's particularly concerned about another, what's called an adjuvant, which is an ingredient added to vaccines to kind of help make them work better. That's in a lot of childhood vaccines that Kennedy hinted at. He wanted on the agenda for this meeting. It came off the agenda, but he presumes they will circle back to it. And if companies can't use that ingredient in their vaccines, he's not really clear they have anything else that is as good and as safe and could force them out of the market. So there were a bunch of hints of things concerning fights to come. The other big one was that they were saying they want to review the totality of the childhood vaccine schedule and the amount of vaccines kids get, which was really a red flag for people who followed the anti-vaccine movement because anti-vaxxers have a lot of long debunked claims that kids get too many vaccines, they get them too close together, and scientists, again, have thoroughly debunked that, but they still push that.
And that was something else that Kennedy promised Cassidy he wouldn't mess with, if I recall correctly, right?
The nature of the agreement between Cassidy and Kennedy keeps getting more confusing to me, and I actually kind of talked to both HHS Secretary's office and Cassidy's office last week about that, and they both don't actually agree on quite exactly what the terms were, but anyway, I looked at it in terms of the terms, like whether it's to preserve the recommendations ACIP has made over time at the childhood schedule, whether it's preserve the committee members. I think it's pretty clear that Kennedy has violated the sort of heart of the matter, which is he has gone after safe, effective vaccines and people's access to vaccines in this country in ways that are likely to be problematic. And there's hints of more to come. He's also cut off funding for vaccines globally. So I don't know. I almost just laugh thinking about what they actually agreed to, but there's really no way Cassidy can say that Kennedy followed through on his promises.
Well, meanwhile, even while ACIP was meeting last week, the HHS Secretary was informing the members of Gavi, that's the Global Alliance for Vaccines and Immunizations, that he was canceling the U.S.'s scheduled billion-dollar contribution because, he said, the public-private partnership that has vaccinated more than 1 billion children over the past 2.5 decades doesn't take vaccine safety seriously enough. Really?
Yeah, Kennedy has these claims, again, that I think are very clearly have been debunked by experts that Gavi is not thinking clearly about vaccine safety and offering vaccines they shouldn't be. And the result is going to be huge gaps in what children can get around the globe to vaccines. And it comes, on top of the other cuts the U.S. has made recently to global health in terms of USAID. So I think these are going to be big impacts. And, they may eventually trickle down to impact the U.S. in ways people don't expect. Like if you think about a virus like COVID, which continues to evolve, one of the fears that people have always had is we get a variant that is, as it evolves, that is more dangerous to people and, we're less able to sort of protect with the vaccines we have. If you allow the virus to kind of spread through unvaccinated communities, because say you weren't providing these vaccines abroad, that increases the risk that we get a bad variant going on. So obviously we should be concerned, I think, just about the millions of deaths people are saying this could cause globally, but there's also impacts to our country as well and our health.
I know there's all this talk about, soft power, humanitarian assistance and helping other countries. But, as long as people can get on airplanes, it's in our interest that people in other countries don't get things that can be spread here too, right?
Yeah, one very small comment that was made during the ACIP meeting this week from CDC staff was an update on the measles outbreak, which I just thought was interesting. They said that The outbreak in the South from earlier this year has mostly under control, but people are still bringing in measles from foreign countries. And so that's very much a real threat.
Yeah.
It's the lesson that we just keep not learning again and again, which is, if you allow diseases to spread anywhere, it'll inevitably impact, us here. We don't live on an island. We have a very interconnected world. You can't have we're going to only protect our people and nobody else mentality, because that's just not how it works. And we're reducing resources to vaccinate people here as well.
That's right. Turning back to abortion, there was other news on that front this week. In Wisconsin, the state Supreme Court formally overturned that state's 1849 abortion ban. That was the big issue in the Supreme Court election earlier this year. But a couple of other stories caught my eye. One is from NBC News about how crisis pregnancy centers, those anti-abortion facilities that draw women in by offering free pregnancy tests and ultrasounds, are actually advising clinics against offering ultrasounds in some cases after a clinic settled a lawsuit for misdiagnosing a woman's ectopic pregnancy, thus endangering her life. Alice, if this is a big part of the center's draw with these ultrasounds, what's going on here?
I think it's a good example. I want to stress that there's a big variety of quality of medical care at these centers. Some have actual doctors and nurses on staff. Some don't at all. Some offer good evidence-based care. Some do not. And I have heard from a lot of doctors that patients will come to them with ultrasounds that were incorrectly done or interpreted by crisis pregnancy centers. They were given wrong information about the gestation of their pregnancy, about the viability of their pregnancy. And so this doesn't surprise me at all based on what I've heard anecdotally. People should also remember that these centers are not regulated as much as health clinics are. And that goes for things like HIPAA as well. They don't have the same privacy protections for the information people share there. And so I think we should also keep in mind that women might, be depending more and more on these going forward as Planned Parenthoods close, as other clinics close because of all the cuts we just talked about. These clinics are really proliferating and are trying to fill that vacuum. And so things like this should keep people questioning the quality of care they provide.
Yeah, and of course, layer on top of that, the Medicaid cuts. There's going to be an increased inability to get care, particularly in far-flung areas. You can sort of see how this can all sort of pile onto itself. Well, the other story that grabbed me this week comes from the Pulitzer Prize-winning team at ProPublica. It's an analysis of hospital data from Texas that suggests that the state's total abortion ban is making it more likely that women experiencing early miscarriages may not be getting timely care and thus are more likely to need blood transfusions or experience other complications. Anti-abortion groups continue to maintain that these bans don't impact women with pregnancy complications, which are super common for those who don't know, particularly early in pregnancy. But experience continues to suggest that that is not the case.
Yeah, this is a follow-up to a lot of really good reporting ProPublica has done. They also showed that sepsis rates in Texas have gone way up in the wake of the abortion ban. And so anti-abortion groups like to point to the state's report showing how many abortions are still happening in the state because of the medical emergency exceptions and saying, see, it's working. People are using the exceptions. And it is true that some people are, but I think that this kind of data shows that a lot of people are not. And again, it fits with what I hear anecdotally. There's just a lot of variety on the ground from hospital to hospital, even in the same city, interpreting the law differently. Their legal teams interpret what they can and can't provide. It could depend on what resources they have. It could depend on whether they're a public or private hospital and whether they're afraid of the state coming after them and their funding. And so I think this shows that one doctor could say, yes, I do feel comfortable doing this procedure to save this woman's life. And another doctor could say, I'm going to wait and see. And then you get, the sepsis, the hemorrhage. These are very sensitive situations when even a short delay could really be life and death or be long-term health consequences. People have lost the ability to have more children. We've seen stories about that. We've seen stories about people having to suffer a lot of health consequences.
And in the case
their doctors figure out what kind of care they can provide.
So in the case of early miscarriage, I mean, the standard of care is either it's to empty the uterus, basically, to make sure that the bleeding stops, which is either a D&C, which of course can also be an early abortion, or using the abortion pill mifepristone and misoprostol, which now apparently doctors are loath to use even in cases of miscarriage. I think that's sort of the take home of this story, which is a little bit scary because early miscarriage is really, really, really common.
Absolutely. And, this is about the hospital context, which is obviously very important. But I'm also hearing that this is an issue even for outpatient care. So somebody is having a miscarriage. It's not severe enough that they have to be hospitalized, but they do need this medication to help it along. And when they go to the pharmacy, their prescription says missed abortion or spontaneous abortion, which are the technical terms for miscarriage. But a pharmacist who isn't aware of that, isn't used to it, it's not something they see all the time. They see that and they freak out and they say, oh, I don't want to get sued. And so they don't dispense the medication, or there are delays. They need to call and double check. And that has been causing a lot of turmoil as well.
All right. Well, finally this week, Elon Musk is fighting with President Trump again over the budget reconciliation bill. But the long shadow of DOGE still lives on in federal agencies. On the one hand, the Washington Post scooped this week that DOGE no longer has control over the grants.gov website, which controls access to more than $500 billion in federal grant funding. On the other hand, I'm still hearing that money is barely getting out and still has to get multiple approvals from political appointees before it can basically get to where it's supposed to be going. NPR has a story this week with the ominous headline, "Where's our money? CDC grant funding is moving so slowly, layoffs are happening." I know there's so much other news happening right now, it's easy to overlook, but I feel like the public health and health research infrastructure are getting starved to death while the rest of us are looking at shinier objects.
Yeah, I mean, this is like the whole flood the zone strategy, right? There's so many things going on that we can't possibly keep up with all of them, but this is extremely important. I think if you talk to any research scientist that gets federal funding, they would tell you that things have not gotten back to normal, and there's so much litigation moving through the courts that it's going to take a really long time before this is settled. Period.
Yeah, we did see yet another court decision this week warning that the layoffs at HHS were illegal. But a lot of these layoffs happened so long ago that these people have found other jobs or put their houses up for sale. I mean, you can't quite put this toothpaste back in the tube.
Right. And also with this particular ruling, this came from a Rhode Island federal judge, a Biden appointee, so it wasn't very surprising, but it said that the reorganization plan of HHS was illegal, or not illegal. It was a temporary injunction on the reorganization plan, and said HHS cannot place anyone else on administrative leave, but it doesn't require them to rehire the employees that have been laid off, which, is
Yeah, well, we will
also interesting.
We will continue to monitor that. All right, that is as much of this week's news as we have time for. Now it's time for our extra credit segment. That's where we each recognize the story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Sarah, you were first to choose this week. Why don't you go first?
I took a look at a Wired piece from Will Barr, Snake Venom, Urine, and a Quest to Live Forever inside a biohacking conference emboldened by Maha. And it is about a conference in Texas kind of designed to sell you products that they claim might help you live to 180 or more. A lot of what appears to be people essentially like preying on people's fears of mortality, aging, death, to sell things that do not appear to be scientifically tested or validated by agencies like FDA. I mean, the founder even talks about using his own purified urine to treat his allergies. They're microdosing snake venom. And it does seem like RFK is sort of emboldening this kind of way of thinking and behavior. One of the things I thought was really interesting about this story is, the author can't quite pin down what unites all of these people in their interest in this space. In many cases, they claim they are there's not a political element to it, but since I covered the pharma industry very closely, they all seem disappointed with like mainstream medical systems and the pharma industry with the U.S., and they are seeking other avenues. But it's quite an interesting look at the types of things they are willing to try to extend their lives.
Yeah, it is. It is quite the story. Maya, why don't you go next?
My extra credit this week is from my Axios colleague, Tina Reed. It's called New Docs Get Schooled in Old Diseases as Vax Rates Fall. And it's all about how medical schools are adjusting their curriculum to teach students to spend more time on measles and things that we have considered to be wiped out in the United States. And I think, it really goes to show that this is something that is real and that's actually happening. People are coming to emergency rooms and hospitals with these illnesses, and young doctors need to learn about them. You already have so many things to learn in medical school that, there's certainly a trade-off there.
There is indeed. And Alice, you have a related story.
Yes, I do. So this is from the New York Times. It's called I Feel I've Been Lied To When a Measles Outbreak Hits Home by Eli Saslow. And it's about the measles outbreak that originated in Texas. But what I think it does a really good job at is, we've talked a lot about how people have played up the dangers of vaccines and exaggerated them. And in some cases, outright lied about them, and how that's influencing people, fear of autism, et cetera, fear of these adverse reactions. But I think this piece really shows that the other side of that coin is how much some of those same voices have downplayed measles and COVID. And so, we have this situation where people are too afraid of the wrong things, vaccines, and not afraid enough of the right things, measles and these diseases. And so in this story, people who are just, including people with some medical training, being shocked at how bad it is, at how healthy kids are really suffering and needing hospitalization and needing to be put on oxygen. And that really clashes with the message from this administration, which has really downplayed that and said it's mainly hitting people who were already unhealthy or already had pre-existing conditions, which is not true. It can hit other people. And so, yeah, I think it's a very nuanced look at that.
Yeah, it's a really extraordinary story. My extra credit this week is from the medical journal The Lancet, and I won't read the entire title or its multiple authors because that would take the rest of the podcast, but I will summarize it by noting that it finds that funding provided by the U.S. Agency for International Development, which officially closed up shop this week after being basically illegally dissolved by the Trump administration, has saved more than 90 million lives over the past 2 decades. And if the cuts made this year are not restored, an additional 14 million people will die who might not have otherwise. Far from the Trump administration's claims that USAID has little to show for its work, this study suggests that the agency has had an enormous impact in reducing deaths from HIV and AIDS, from malaria and other tropical diseases, as well as those other diseases afflicting less developed nations. We'll have to see how much, if any, of those services will be maintained or restored. Okay, that's this week's show. Thanks to our editor, Emery Hudeman, and our producer-engineer, Francis Ying. As always, if you enjoy the podcast, you can subscribe wherever you get your podcasts. We'd appreciate it if you left us a review. That helps other people find us, too. Also, as always, you can email us your comments or questions or at whatthehealth, all one word, at kff.org. Or you can find me on X at jrovner or on Blue Sky at Julie Rovner. Where are you guys these days? Sarah?
I'm a little bit on X, mostly on Blue Sky at Sarah Karlin or at Sarah Karlin-Smith.
Alice?
Mostly on Blue Sky at Alice Miranda, still a little bit on X at Alice Ollstein.
Maya?
I am on X at Maya Goldman _ and also on LinkedIn. You can just find me under my name.
We will be back in your feed next week. Until then, be healthy.